Hello, everyone. Hello, and welcome to today's webinar. I am Abraham Johnson, Senior HIV Community Engagement Officer for Treatment Action Group, and I'm so excited for you all to join us today for the power of prevention, pleasure in the Black community. We are joined today by a powerful panelist. And we're gonna have some fun today, right, you all? We're gonna have some fun today. We're gonna talk about PrEP in Black America and all of the great work that we have been doing amongst organizations. But before we get started, as you all know, today is National Black HIV Awareness Day, and there are so many intersections of HIV and social justice. And as we did witness, unfortunately, another killing of a Black man. So if y'all don't mind, I would like to have a moment of silence for Brother Tyree Nicholas. Thank you. Oof. So I want to quickly go over the agenda today. We will have opening remarks from Kenyon Farrow and Alicia Beach McKinley. We will also have an important overview of the PrEP in Black America roadmap, which you will learn more about. And secondly, we'll have Dr. Tasha Smith, Michael Chansley, Abraham Johnson, Kenyon Farrow, who will participate in a Q&A session. And I'm sorry, Dr. Tasha Rogers. And lastly, Michael has a special announcement about PrEP in Black America. So I'll pass it over to you, Alicia.
Thank you so much, Abraham. I started looking for Tasha Smith, but I tell you what, I really do enjoy Dr. Tasha Rogers.
Yes, it was a typo on my agenda. So apologies, Dr. Rogers.
That's all right. You're going to get some of that Tasha Smith flair with Dr. Rogers anyway. So stay tuned. That's your preview. It gives me great honor to just share very briefly about the history of the PrEP in Black America convening group. Last year, our late great Dr. Dawn Smith and I were attending a meeting. She and I, along with Dr. Rogers and Carrie Reed, are all members of the Atlanta Black Women Leaders on PrEP. And Dr. Smith said something that literally shook me to the very foundation when she said, there is a place for us to address Black women in PrEP and Black gay men in PrEP, but are we doing the community a disservice if we're not talking about Black communities as a whole as it relates to PrEP? And will that help us address PrEP in populations such as Black women, same gender loving men, heterosexual men, if we are addressing it also within Black communities? And when she said it, I didn't have an answer, but I knew somebody that I could go to, somebody who was way smarter than me and that I trust and is very strategic. Laughing because he know I'm talking about him, and that's Mr. Kenyon Farrow. And I had this conversation with Kenyon, and he immediately started just laying out the strategy. And he said, but you got to have this person. We need to have this person on. And by the time we finished identifying all the persons that needed to be present, we had this amazing divine nine of Mr. Rico Boone, Abraham Johnson, Danielle Campbell, Rania Copeland, Kenyon, John Mead, Stacy Smallwood from Georgia Southern University, and then two young men who could literally pass as my own children, Justin Smith and our fabulous convener, Michael Chansley. And so when you tell the story as PrEP in Black America continues to grow, I want to make sure that we are honoring and uplifting these 9 brilliant, intelligent Black people who are giving of themselves in addition to their paid positions and ensuring that our community will not be left behind. This is our PrEP in Black America history. So Michael, I'm sorry, Kenya.
Yeah, so I'll only add a little bit to that. Thank you. So as Leisha pointed out, after we had the conversation, was it about a year ago, maybe before? A couple things were clear to me. So one is we needed to think about how to do a convening that would both, sort of bring some key leadership into the space to talk about what some of the continued barriers and challenges are to PrEP access, particularly for Black folks, and also to talk about what we are seeing that's working in some places, right? And to be able to begin to make, some recommendations for, federal policymakers and for, public programs, right, to implement around the country. This happened at a kind of fortuitous time, for a couple of different reasons. One of which was last summer, July of 2022, was the 10th anniversary of the first medication for PrEP being approved by the FDA. So we knew that having the kind of 10th anniversary, it was time for us to reflect back, given a lot of the data that many of us have looked at or participated in creating around the persisting racial disparities in terms of PrEP use. Well, it started back to not PrEP knowledge, right, of what PrEP is, to use and, continue persisting to use PrEP over the course of time. And knew that the 10th anniversary would give us an opportunity to kind of reflect back on those 10 years and where we made progress, where we needed to make more progress. The second thing that happened last year that also made this an opportune time to sort of begin to have these conversations was President Biden, about this time last year, announced or proposed, in his upcoming, or at that point, his FY23 budget, resources to build a national PrEP program, which organizations like PrEP for All, Johns Hopkins University, and some other activists have been calling for as a way to figure out a infrastructure to help us pay for and deliver PrEP, particularly to people who are uninsured. And we know that many of our folks, particularly in the South and in non-Medicaid expansion states, still a large coverage gap, right, to be able to access PrEP. So we knew that last year kind of gave us two, kind of key opportunities to really begin to engage with other, prevention advocates around the country, around, what would be needed in order to expand PrEP access in Black communities. And should we get funding for a national PrEP program, how can we ensure that this program actually serves the needs of Black folks around the country? And that led to the first summit we had last year, and and some of the things that we're going to talk about today. So I'm really glad to be here with this group of folks and looking back on the work over the last year, and to talk about where we are with PrEP today on National Black HIV/AIDS Awareness Day.
Thank you, both Leisha and Kenyon. And we will now have a recap video of our first PrEP in Black America Summit. So Michael, there isn't any sound.
Country and globally. And we've priorities of what a national PrEP program would need to look like in order to address the racial disparities, particularly among Black folks in PrEP access, use, adherence, et cetera, that we all know. Nearly since the beginning of the epidemic, Black people have been disproportionately impacted by HIV in this country and globally. If we have any sort of seriousness at all about, ending the HIV epidemic, as we've been sort of talking about the last decade, then Black people have to be at the, front of the line in terms of, access to treatment and to prevention. And PrEP is a, major prevention strategy.
Today, only 9% of Black people who could benefit from PrEP are using it.
We have absolutely every tool we need now to end HIV. PrEP is one of them. And when we think about the amazing medical advances of PrEP and how Black communities could benefit greatly from it, but we're not. You have to look at the reasons why. And everything is not about personal behavior and choice. Some of this is the infrastructure and the systemic issues that Black people have had with HIV from its very existence.
When we look at HIV and we see how we are disproportionately affected, we are only 13% of the US population, yet we consist of more than 50% of the new HIV diagnoses every year. Until we examine those things, HIV is always going to be prevalent within our communities, regardless of the level of access that we have.
Right, we're at the culmination of more than 450 years of systemic oppression. And that systemic oppression sits right at the juncture of sexual and reproductive health rights and justice. So when you talk about HIV and you lift up all of the societal ills that create vulnerability, and at the top of all these measures or indices of vulnerability sit Black people.
When you are part of a community that's either been over-sexualized or demonized because of your sexuality, having something that relieves that anxieties, having something that puts you in control of your sexual health is definitely something we all need access to.
PrEP is a really powerful tool that we have to combat HIV. And really, unless we're able to get PrEP to Black people, it will be impossible to end the HIV epidemic.
I'm grateful this summit was organized to find solutions to the problem of uptake in the Black community.
I think what stood out the most to me today was that people were hungry for this conversation. These are people who are advocates, they're peer navigators, they're PrEP users, they're PrEP navigators. They see what's happening.
And when you look at all those strategies, and I'm seeing that we're all coming at it from very different angles, I think that that's a beautiful thing. And I think that that's how we move forward.
I think what really worked well today with the PrEP in Black America Summit is we didn't just come together and brag about the work that each individual or each organization is doing. We didn't just come together to spread awareness. We actually came together to talk about the challenges and the systemic barriers we have to get in the Black community on PrEP.
There is something fundamentally missing with the way the systems of care, treatment, and prevention are set up. They are not set up to serve our people for a various number of reasons that we've described here today.
It really moved me because I've been in the work since 2012, right? And before 2012, but certainly since, PrEP was, first approved, the first drug approved for PrEP. And it never occurred to me that what we were doing today was the first time that this sort of thing had happened before.
Today's meeting was really so important because it was about figuring out the beginning of the roadmap that will allow us to ensure that we have equitable access to PrEP specifically for Black people.
Thank you for that, Michael. And I just want to give a special shout out to Thrive SS for allowing us to use their space. So thank you, Thrive. And also one other thing, feel free to ask questions in the Q&A chat box throughout the webinar, and I'll be sure to answer those at the during the Q&A session. And next up, we have Danielle Campbell, who I'm a huge fan of. Danielle, she pulled out this roadmap. It was so amazing, and she will present some of the findings from the PrEP in Black America Summit. And I will pass it to you, Danielle.
Thanks, Abraham, and thanks to all of the attendees at today's summit webinar. We are immensely overjoyed that you all are so hungry, as Leisha said, for this conversation around HIV, biomedical HIV prevention in Black people. You all are as excited as we are. We are 120 strong on this webinar. So my role really is to document this effort from the ground, right? To report back to you all, but really to provide a framework, a concrete framework informed by Black folks about what we need to do to solidify a concrete plan for increasing uptake of PrEP and other strategies around HIV prevention. So Michael has agreed to share the screen so I don't disrupt the webinar, because I will certainly tear up your little webinar.
Can you see it?
So yes, I can. Thank you. So before you, you have the inaugural master plan for HIV prevention in Black America. It's entitled, and aptly so, For Us, By Us, PrEP in Black America. It's presented on behalf of the PIBA, PrEP in Black America, or Summit Organizing Committee. Next page. So a couple of folks that we need to acknowledge and organize: the Red Hot organization, Atlanta Black PrEP Leaders, AVAC, Equity and Impact Solutions, the iStrive Research Lab, Positive Impact Health Centers, PrEP for All, TAG. Definitely thank you to all of these folks who gave birth to this alongside me as I really sat with all of the transcripts, recordings, notes, posted cards, the whole setup to be able to culminate this information into this brief report that you see here. Next page. So we grounded the report with a message from the incomparable Fannie Lou Hamer. And she says, and you can always hear this long sob story. You know, it takes time. Well, for 300 years, we've given them, the proverbial them, time. And I've been tired so long now. I am sick and tired of being sick and tired. And we want change. So this report and this PIBA Summit Organizing Committee galvanized our leadership, not only in light of the 10th year anniversary of approval of PrEP by the FDA, but for the most part, we are sick and tired of being sick and tired and seeing the epidemiologic trends as it relates to HIV in our communities. So from that level of fatigue and frustration came the PIBA Summit. So on the right are the organizing committee. You're talking about the Divine 9. I'm going to say the Divine 10. We would not be here if it were not for Mother Leisha McKinley Beach, who gathers us, right? She gathers us alongside Mr. Michael Chansley to keep us on the right track and accountable to each other for this work and our commitment to our people. So a quick shout out and acknowledgement of those who really matter. I know she keeps trying to take herself to the background, which I really don't like, but we have got to acknowledge Mama Leisha for all of her hard work for keeping us together. So Leisha, thank you, my dear. Next page. So the report begins with a brief epidemiologic snapshot of HIV in the Black community. So to Kenyans ever relevant point, HIV has always disproportionately impacted Black populations, even though those images and well-produced movies would have you believe that a certain demographic of people have been overrepresented in this epidemic. We and the data arguably argue something different. So we provided a brief graphic from the CDC on the left to describe what the burden of HIV, the burden of the epidemic, in which populations it has lied. And then on the right here, we bring some cute little information about what the research has demonstrated regarding the efficacy and effectiveness of PrEP. So across all strategies and modalities, we want people to understand that there are not only options, but that research has demonstrated that these options are in fact effective if you take them. And so we transition there by talking about how PrEP use remains unequal. So given, next slide or next page. Given the effectiveness of the research in demonstrating PrEP's effectiveness, what we see here on the left is more information that despite the effectiveness of PrEP, populations of people, in particular, Black people, are not using PrEP. So 9% of PrEP users were Black or African American. When you juxtapose that to where the burden of HIV lives in this country and globally, there are inequities that the PIBA Summit worked very diligently to unpack. So we ground the report in talking about or acknowledging our past as a way to move forward into our future. So we had Dr. Oni Blackstock talk about some of the social structural factors that prevent Black people from not only optimizing care, but HIV specific care. And so that's the figure you see on the right, and that leads us directly into our conversation about recommendations to end HIV, or not end HIV, but increase PrEP in Black America. Next page. So we were able to distill 3 very easy to follow recommendations about how to increase PrEP in Black communities. So the first of which is to energize the Black public health workforce to lead the HIV prevention response. And it takes you back to the For Us, By Us title. We are the masters of our lived experience. We understand our health or lack thereof in this country, and we for damn sure understand what needs to happen, what structures need to be in place to improve health. What we need is, right, the support and realignment of systems of power and oppression that contribute to the negative health outcomes that you see in Black populations, to reorganize and situate Black leaders with the lived experience and expertise to navigate the public health response to end HIV in Black communities. As we have those systems of oppression and power realign, we want to concurrently ensure that the masses of Black people are educated about the science and effectiveness of PrEP. Regardless of gender identity, PrEP awareness and uptake is low. So we know, based upon some of the responses from attendees on the right, that there is still a fundamental lack of knowledge and awareness about PrEP in this country, even though millions and millions of taxpayer dollars have been dispensed to increase PrEP uptake. Something as basic as information and knowledge is missing from our community. Last but certainly most certainly not least, folks decreed public support of a federally funded national PrEP program. Shout out to PrEP for All and their team for bringing together these recommendations, but the long and the short is that PIBA attendees supported universal access to health benefits associated with HIV prevention without judicial, legal, or financial impediments. So folks want to be able to access PrEP without all of the extras that we know come along with accessing health services in this country. So we want to make sure that PrEP is available as a standard component of routine sexual health services. that it's inexpensive or no cost to users. And folks need to explore strategies to expand the pool of racially reflective providers who prescribe PrEP. So enter Dr. Tasha Rogers. Next page. So the long and the short, right? Black folks are tired. We are tired of telling y'all we tired. And we are aligning ourselves, and we are organizing across the public health sector to do something different to improve the health of Black people, as is evidenced by not only who is on this call, but the folks who have supported this effort. And so we ended with a strong supporting quote from the incomparable Phil Wilson, and he says, "We were greater than the Middle Passage. We were greater than slavery. We were greater than Reconstruction, and we were greater than Jim Crow." So all of the racial impediments that systems of oppression have put in our way to keep us subdued. We are greater than the war on drugs, and we will be greater than HIV and AIDS. So on the right here, you see an infographic that really sums up the report. And we do hope that you all enjoy and will share across your respective fields of work. With that, I'll stop and hand it back over to Mike.
Thank you so much, Danielle. That was wonderful. And stick around, you all. Danielle will be able to answer questions in detail about the roadmap. And just moving along with the webinar, we will now have our Q&A session. And I will introduce our first panelist, Dr. Tasha Rogers, who is an OBGYN in Atlanta, Georgia. She's a native of Philadelphia. Go Eagles. I know she's excited for the Super Bowl this weekend. She received her BS in chemistry from Drexel University, but instead of going into the chemical industry, she decided to take a path in medicine. So fast forward to 2023, Dr. Rogers is still striving by the minute when it comes to not only her private practice of educating women daily on women's health and other social issues, but she is the only physician in Southwest Atlanta, Georgia, who is educating women about HIV prevention, known as PrEP and PEP. Welcome, Dr. Tasha Rogers.
Hello, everybody. Hello. I am so honored to be here. I feel like a little smurf, a little midget on a panel with all these greats. So I am so honored, and I'm so happy you guys had me today. I'm just so excited. You know, I like to talk to people, and PrEP is my jam. So I'm super excited about that.
Thank you, Dr. Rogers. And next we have Carrie Reed, who is the HIV director for Cobb and Douglas Public Health, where she manages the strategic direction and daily operation of the HIV prevention program. Before joining Cobb Douglas Public Health, Carrie served as a contracted public health analyst for the Center for Disease Control and Prevention. In this role, she provided national HIV prevention monitoring and evaluation and technical assistance to cover over 160 directly funded health departments and community-based organizations. Carrie holds a BS in psychology from FAMU and an MPH from Florida International University. Okay, Rattler, right. I'm a Savannah State Tiger, but I'll let you have it. So welcome you all. And of course, we have Kenya Farrow, who is one of the founding members of the PrEP and Black America Committee, and Danielle Campbell. So welcome everyone. So we're going to get into some things today. So my first question is, of course, to you, Danielle, as you presented that beautiful roadmap. Being that you sat with the data and really got a chance to get into the weeds, is there anything that really resonated with you the most about the just going through the data?
Absolutely. So there were a ton of transcripts, a ton of so some of the activities that we had at the summit were organizing folks into smaller group discussions. I think Michael called it the fishbowl. So folks had to go into smaller groups, and we had little post-it charts on the wall where people could respond to questions. So in synthesizing some of the information that were included on those post-its and some of the flashcards that we got back from people, there was an overwhelming respect and acceptance of PrEP. But when you juxtapose that to people's fundamental lack of knowledge, it's insane. And when you contextualize that with all of these efforts that you see about ending the HIV epidemic, it gives you pause. Because you're sitting there like, but wait a minute, y'all are light years ahead of where the community actually is with this PrEP conversation. Folks are saying, baby, if you give it to me, I will take it. But I had no idea that this was even a prevention option for me. Do you know how many people in my family or in my community who could have benefited from taking PrEP? Like, where's the effort to bridge the gap? That was one of the most resounding comments, which is why I think that the PIBA report is so, so critically important. We need to bridge the gap. That's the only way we'll get to a space where we can begin to entertain ending the HIV epidemic in Black communities.
Thank you, Danielle. And speaking of bridging the gap, I think this is a perfect segue to physicians, right? We know that doctors play a major role in communities and also access to PrEP. So my next question is for you, Dr. Rogers. What are some ways and roadblocks when we think about talking about PrEP to clients or community members? Like, what do you see as a roadblock, and how do you get your patients to be more engaged into PrEP?
Okay, so that's a great question. For me, I think that the way in which to communicate, and I think a lot of providers are very confused as to how to communicate about PrEP. When it comes to PrEP, and I think this is an issue, to be perfectly honest, when we see HIV in the Black community, our younger populations, they identify as things primarily. They identify as MSM, they identify as this, they identify as that, but they identify as Black further down the line. And I think back in the day where we had more solidarity, people were identifying as Black initially. I'm Black, I'm a Black doctor, I'm a Black lawyer, I'm a Black this, I'm a Black hetero, I'm a Black MSM, but we were Black initially. And I think that's starting to kind of change a little bit now. When you are communicating or educating patients in the African-American community, you cannot negate the culture. You have to accept the culture and you have to educate within the culture. You have to understand that there's a fundamental distrust of the medical community, as there should be. We can't ignore that. We have to kind of educate within that. The biggest thing is, and the hardest thing about education right now is, doctors probably know less about PrEP than patients actually do. It is so scary. I mean, I have a couple of patients who are female physicians and come on the regular for STD testing. And I'm like, hey, you ever consider PrEP? And they're like, I'm not gay. You're a whole physician. So if you don't know, how the heck can you help somebody else? And so this is what I'm kind of seeing. And then when we also hit the disparity in medicine, we have to look at a situation of sometimes they don't put the best physicians in our communities. Oftentimes there are not enough of us that are in our own community. So people are not as vested or invested in our health.
Thank you. You made a great point about keeping PrEP with like how we describe and how we identify as Black first, right? So I want to pivot to Michael, who is a person who uses PrEP, right? And I think that we often don't see a lot of Black people being loud about using PrEP, right? So Michael, when some of the communities that you sit within, and we know that especially in Black communities, there are a lot of myths around PrEP. So how do you start the conversation about PrEP, and what has your experience been like talking about PrEP to members in the community?
You're muted.
One day I'm going to remember to unmute myself before I start talking. I think, I remember going to a conference where several people got on stage and they talked about the research about PrEP and the importance of PrEP. And somebody stood up and said, okay, but where are the people? You're telling us about PrEP, but where are the people who are actually on PrEP? Somebody said in the audience, so I know sometimes we want to keep this level of what we might consider professionalism and careful with what we share with the community, as advocates, careful what we share about our personal lives with our community and with our clients. But personally, I'm always just very transparent. I know people who are on PrEP who say, hey, you know what? I don't want to be the public face of PrEP, and I definitely respect that when you're an advocate in this field. But for me personally, I think it's important to share those stories, not just the stories about not just saying, oh, I'm on PrEP and this is what it's done for me, but also talk about the challenges I have when engaging a provider who may not be as knowledgeable, engaging a provider who may not be sex positive, talk about the issues I've had in between jobs when I haven't had insurance and how to navigate these medication assistance programs and free PrEP programs that are not as easy to navigate because of all of the paperwork. One thing I always would tell clients is, I know it's hard to open up to someone, as a PrEP navigator and talk, or a provider, and talking to them about your sex life. So I always open up with a joke, like while I'm asking questions to kind of get information, help them. I always say, it's nothing you could tell me. Once I get off, I could probably tell you something funny. I could probably tell you some better stories than what you have. And they usually like burst out laughing, but that kind of like opens up that conversation. So I definitely think it's important that we see more people who look like us in campaigns, more people talking about their experiences with PrEP, positive and negative. I always let people know, I've been on PrEP for 8 years now, and I've never had any side effects. I always talk to them, but I am transparent, as somebody who's counseled people on adherence and staying in care, how I miss my PrEP appointments and I forget to take my pills some days, and how I've had to work around that just to take control of my sexual health. So being able to have people at the forefront and saying, I look like you, I'm from the same community as you, I run into the same barriers in accessing PrEP as you, but these are some of the positive effects being on PrEP has had on my mental health, on my sex life. So definitely just having those open and honest conversations. And again, I respect that some of us don't want to be the poster child for being on PrEP, but so I just weighed the options and it was like, hey, it's more important that my community see that I'm somebody who's dealing with navigating this epidemic and taking care of my sexual health the same way that they are.
Thank you, Michael. It's something you mentioned about pleasure and your sex life. I'll come back to that point about like how we need to talk more about pleasure and sex and being more sexually liberated around PrEP. My next question is to you, Carrie, around health departments, right? So I'm going to be honest. So sometimes when I talk to my friends about health departments and some of their experience, they don't always have the most positive experience with health departments. But I know that health departments play a critical role in really the uptake in PrEP and being able to really get PrEP to communities. So what is the role that the health department plays in really supporting Black-led clinics around PrEP, but overall, like what is the role of health departments as when we think about PrEP?
So a couple of things come to mind and a couple of things that we kind of suck at come to mind for sure. I think we talked earlier, someone mentioned earlier about those Medicaid or non-Medicaid expansion states. And looking at where they are geographically, most of them are in the South. And when you look at how many public health entities in those states have actually deemed racism a public health crisis, how many do we have? I can literally count it on one hand. But the thing is, I think making those declarations will lead us one step closer to additional funding and making sure that we are advancing our health and racial equity. And hopefully resources, comes along with that. And we haven't had, and when I say we, I mean health departments have a habit of just kind of holding on to dear life for funding, kind of like that kung fu grip. Am I telling my age? But you know what I mean. So one thing that we have to do is make sure that these resources are being reallocated to these Black-led community-based organizations, these clinics, and that will ensure more access points for PrEP. My jurisdiction is a prime example. We literally have 4 providers in our area that are prescribing PrEP. And that can't be the case. There's no way we can end the epidemic like that. So we need to make sure that resources are going to these other clinics and community-based organizations that have a focus on Black and Brown folks and that have a history of making meaningful change. I really hate that you're hearing stories of friends having bad experiences at health departments. And I will say, just from my experience with PrEP navigation, it is a pain. It is a pain, and it's been a learning process. So I think that's something else that we need to do. All the lessons that we've learned in PrEP navigation, we need to be able to share that with other organizations. I don't want to quote a rapper, but I went through that, so you don't have to go through that. So, and I think that's how we kind of work together to make things easier access, more access points. And Dr. Rogers talked earlier about boosting that PrEP knowledge. That's something that we're doing with the health department as well as one of our EHE initiatives, is making sure that we are communicating with providers in our area, letting them know about PrEP, even having conversations with them around sexual history taking. Yeah, that's a struggle in itself, especially when the providers don't look like people that they're serving, which is why it's also important to have these Black-led community organizations.
Thank you so much, Carrie. And coming to you next, Ken, around policy. So I know a lot of your work has been around the National PrEP Program and an importance of that, but also as it relates to the Black community. So something that Carrie said was around the paperwork and the pain that it takes for a person to get on PrEP. So can you touch on the National PrEP Program and its importance to the Black community?
Sure. So, first I'll say too, is also somebody who's been on PrEP since 2015. And I was at Treatment Action Group as the policy director when I started. And when I, first got on PrEP, left, got all my tests done. The nurse at my doctor's office, was like, okay, where do you want the prescription sent? I told her the pharmacy, and which is close to my house. And when I leaving the clinic, before I left, I got a call on my cell phone from the nurse saying, hey, no, actually not from the nurse, but from the pharmacy, saying, hey, we just got a prescription for you. We cannot fill it, right? And I was like, wait, what? Okay, so I went back into my doctor's office, spoke to the nurse. She said, okay, well, I don't know what happened, but let's send it to the pharmacy downstairs, right? And, in the same building, and, we'll get it filled internally. Cool, I go downstairs, I wait, they call my name. They said, we can't fill it, right? And so I left there and spent the next 2 days on the phone arguing with my insurance company. And this is how I learned about prior authorization. And I having been in this work that long, right? This was the first time I had to deal with that, right? And then being forced into a specialty pharmacy, which, as somebody who travels a lot, that was, pre-COVID, obviously, and, having prescriptions just show up and be on my doorstep for days while I was gone was not convenient. So this is how I started to kind of think about the sort of policy implications, right? To tell that sort of personal anecdote. So when we talk about the National PrEP Program, what we're attempting to do is kind of address a couple of different pieces, right, through policy. So first and foremost is coverage for people who don't have insurance, because still the easiest sort of way to get PrEP, even with a range of paperwork and stuff, is do you have insurance, right? First, right? Because we already have some things in place in terms of federal policy that requires insurance companies to cover PrEP, right? Like, so they don't, obviously PrEP for All has already been doing some work on making sure those insurance companies adhere to the law. But generally speaking, there's at least some framework there if you have insurance to get it covered. If you're uninsured and you're in a place that doesn't have a, PrEP access program or, an FQHC that, is providing PrEP services for free, then you have a very difficult time, which, as what was already stated by Carrie, then the non-Medicaid expansion states in the South. And we already see some data, looking at the racial disparities are far greater in the non-Medicaid expansion states. There are more Black people or greater percentages of Black people on PrEP in states that have expanded Medicaid. That's just point blank period, right? And often the states that have expanded Medicaid also have those statewide PrEP, access programs, right? So there's that sort of correlation. So the National PrEP program is first and foremost trying to kind of close the coverage gap so that people who don't have insurance can get access to PrEP. Second thing, and also PrEP services, so not just the medication, but that the labs are covered, the doctor visits are covered, right? All of the whole kind of prevention package in that perspective. First, by some of the things that we're attempting to do is that just creating a sort of infrastructure so that people can get access to PrEP. But then there are other pieces of it that have been talked about. One, we still have low knowledge of PrEP, right, in our communities writ large, and so needing to kind of reset a baseline of just information so people know what PrEP is. Probably all of us on this call have, relatives of mine, when they see the ads on TV, I'm the person they call. They're like, wait, is this, like, what is this? Right. I just saw an ad watching Empire or whatever, like people call. And so, but we need to have, those kinds of national campaigns that really speak to our communities about PrEP as well. So to create the demand piece, make sure that we have the infrastructure for those who are uninsured. And then we also need to do the work to, kind of hold insurers' feet to the fire if you have insurance, to make sure that they're actually doing what they're supposed to do, which is to pay for all the PrEP services at no cost to the individual.
Okay, thank you, Kenyon. And I want to take some questions from the chat box. And I think this is for you, Dr. Rogers. It says, what are ways clinicians can address with clients that Black same gender loving men are at more risk of HIV without stigmatizing clients? So I think in general, how do we kind of demedicalize PrEP and make the conversation more formal while also making sure they get the accurate information?
Okay, so that's a good question, believe it or not. But I think that what we kind of have to do is sometimes as clinicians step away from being clinicians, and it's okay to be people. The easiest way to kind of engage with PrEP is to have a comfortable sexual history conversation with somebody. It doesn't matter if it's to the left, to the right, to the up, to the down, be comfortable. And you have to ask the question, sometimes imparting some humor. Like Michael said, sometimes you have to do whatever you have to do to kind of like break the monotony. And one of the things I'm always like, this is a no judgment zone. You're in a safe place. So say what you got to say, because I'm going to say what I got to say. And, patients respect that. They're like, okay, cool. And they literally step back. And sometimes even the way I ask the questions for like I said, I'm an OBGYN. So I'll say, so are we a backdoor mommy? What we doing? Are we papping this booty today? Like, what are we doing? And it has to be okay. And when they see that I'm okay with it, then they're okay with it. So we kind of got to come down off the high horse and talk to people like we're people, because we are. And once you get an accurate and open and honest sexual dialogue, it's not hard to say, okay, so, we're doing some things, and just physically, just by the way our bodies are set up physically, we're at increased risk for some things. So come on, boo. Have you heard of this? What are we doing about this? We can do this, that, and the third, or we can do this, that, and the fourth. And if you're comfortable with the conversation, you're never going to stigmatize somebody, because that's not the intent and that's not how you're going to come across. So if you're comfortable, so we have to get comfortable talking about sexuality. We got to take the stick out of our booties per se, no pun intended in any way, shape, or form, but we have to, get comfortable having the conversation, and we can impart that on other people. And then they relax, they're honest, and then we can help each other. A lot of the discomfort with providers is because they have a lack of education. They don't know or understand PrEP themselves. So it's like, okay, I can't go into that dark alley because I'm going to say something wrong. Why? Because I'm not comfortable with the conversation that I'm having. So they have to get comfortable with sexual health. That might include getting comfortable with their own sexuality, whatever that may be. Nobody's asking you, boo, nobody cares, but you have to be comfortable enough with you that you make me comfortable with you, that I get the help that I need. And that's really the biggest thing, teaching providers how to get comfortable discussing sexual health so that we can then give patients what they need. And I think a bigger part in the upcoming year is us educating our community, because I think the push this year is really going to be patients pushing doctors to say, why don't you know about this? Because I'm doing it. Like, if your doctor doesn't know, they're a bad doctor. Sorry, find somebody else. Why don't you know about this? This is being offered. This is, my friend is on it. My homegirl is on it. Why don't you know? Like, I want to do this. I need the prescription. Like, what's the problem? How are you not knowing this? So I think we're going to have to start having patients shame the docs into actually, getting on the ball. So I think that's what's going to move the meter. The patients, y'all get on social media, y'all know about everything else. Y'all come in my office telling me how to do a whole hysterectomy because you watched it on YouTube. You can get to these doctors and be like, so, and I think that's what it's going to take a lot more.
Thank you, Dr. Rice. Did you say shame the docs? Did you say?
Yes, absolutely.
Okay, so I remember hashtag shame the docs.
Yes,
Okay.
you should be ashamed that this is a thing and you know nothing about it. Shame on you. So let me educate you and then give me my prescription. Thanks. So yes.
Thank you. Thank you. And I think this is a great question for the entire group, right? It says, how can we make strides to those not here? I feel we are always meeting, which I love, and discussing the lack of PrEP in Black community, where the information we are sharing is amongst us who are knowledgeable. Basically, we are always preaching to the choir, and I totally agree with that. So what should we do differently? And I think that the organizer can talk about what makes what we're doing different and what we plan on doing. So you can, whomever wants to take it.
Well, I'll jump in with that.
Go ahead.
One of the things that I think that we don't do enough of, but I think that it's crucial, we got to get in the trenches. We really got to get in the trenches. We got to show up. We got to be where the people are. We can't expect them to come to us. We got to go to them and give them. So, we can prevent you from getting HIV, right? We have to make it comfortable. We have to make it a part of the conversation. We have to get in the trenches and talk to people and kind of pollinate. And as a community, as a Black community, that's really how we actually function and learn. We pollinate. And this is why, unfortunately, because there's not enough accurate information out there, we have the pollinators of negative information or false stuff, but that's the stuff that goes across social media. That's the stuff that goes across TikTok. But we have to get in the trenches and pollinate with the information and trust that she's going to tell her over crab legs. She's going to tell him over brunch, and that it just starts to travel through our community.
Thank you, Dr. Rogers. Anyone else? Go ahead, Michael.
No, I just want to add to what Dr. Rogers said. Sometimes we have to get in the trenches. I think we have to think outside of the box. I think about, obviously, because I work in the field and I'm interested in the topic, when I see awareness event, I go, but I'm also not naive. I know the average person is not going to go to an event just because it says awareness or something like that. I had a friend, he would organize sex parties, and at the sex parties, he would have take-home tests. He would have information about PrEP, local clinics that offered PrEP. I was on another webinar about a few months ago, and it's a clinic in Pittsburgh that they actually go to the bathhouse. You can get your labs done there, and they'll even on the spot, same day, while you're at the bathhouse, prescribe on-demand PrEP and give you information to follow up to get a full prescription. So you can actually get 4 pills just so you can do on demand while you're there, with follow-up to get a full prescription. So I think sometimes, and I know those ways can, be controversial, but I think we really do have to think outside of the box when you just say, sometimes you're going to miss people when you just say, come to this event where we'll have health information. Some people will go, some people won't, but you do have to meet people where they are, even when that's uncomfortable sometimes, even when that's a little taboo and maybe get pushback. You really have to think outside of the box.
I agree, Michael. And I think what is unique about the PrEP in Black America, steering committee, and what we're really doing non-traditional partnerships to really taking the information to communities. And I think oftentimes that's what is missing. Of course, this webinar, as we talked about, will be sent out, but we also are really being on the grounds and really looking at unorthodox approaches to getting information out about PrEP. So let's see, we have some more questions in the chat box, and it is, were distance and time constraints the key barriers How do we expand this knowledge and awareness in rural communities? Great information. Thank you for sharing. So thank you, Christopher, for this question. So how do we get this information out to areas outside of metropolitan areas?
I can jump in here. I think the community-based organizations are the biggest conduit of that information, right? We know that folks on the ground access services, and in instances where they don't, that's when our non-traditional, unorthodox methods of engagement come into play. We have to continue to push ourselves to reach to the farthest ends of our communities to engage folks. And if the CBOs aren't doing it, then damn it, we have to find other ways to do it. And that's where partnerships like PIBA are a really, really, really great way to get that information out to those communities who may not be accessing services or who may not be asking the questions that we hope they will ask to be the biggest advocates of their sexual health.
Yeah, and I think so. I mean, so in terms of the kind of information set, right, there's, kind of two pieces for me. So one is, something that many of us have, advocated for, have heard folks who work in rural communities have advocated for more kind of telemedicine and other ways to reach people. You can, mail tests, to people, those kind of things to really not have to rely on, a car or, those or public transit, right? If you're in a place that doesn't have it, which also can be in cities, right? I think a lot of people think that just because you live in a metro area, that everybody has equal access to things. And that's just not true, right? I lived in New York City for a very long time. And if there were times like when I lived in East Brooklyn, like in East New York, there were people in my neighborhood who never went to Manhattan, like ever, right? And so you had to so even just to say like in even, rural areas or places where people aren't connected, like some of those kinds of, kind of telemedicine programs, things that we really started to ramp up during COVID, can actually remain in place for other things, right? I think, and, PrEP access is one place to do it. And then secondly, also just relying in terms of on a range of just sort of messaging approaches. So a lot of times if you live in big cities, you have the privilege of having, if you have public transit, you have, health programs that can put, ads in bus shelters and on trains and, in places just because people are in physical space more, where you don't have that in rural or even in smaller cities as much. And so thinking about how, using, but a lot of people, and we know the digital divide is very real still in rural areas, and particularly among Black folks in rural areas, but a lot of people do have mobile phones, right? And so how do you create ads, right, that people still see on YouTube or, other places that you're creating ways for people to access information? And because some of the sort of techniques that we use in big cities in terms of outreach and sort of education don't really work in those spaces. So what are some of the other ways you can, kind of reach folks? And then some of it is the groundwork, right? Going and, asking churches and other spaces where you have critical masses of people congregating. Hey, can I come in and talk about, PrEP to, your congregation, to the youth ministry, to whomever, right? Like whatever the thing is. So I think we have to, it's kind of reiterating the point of like, needing to use, kind of non-traditional strategies in terms of access, but also in terms of information.
Thank you, Ken. And I must say, we have a lot of questions in the chat. Really good questions. I think this is a very important one. And I think it's for you, Carrie. It says, thank you for the recommendation to energize the Black public health workforce to lead HIV prevention response. We have a huge turnover in our workforce. How can we best retain our beautiful Black folks?
Can I agree and say same? We've had basically a mass exodus of sorts, even in our jurisdiction as well. I think one of the things that we are doing to retain folks is, for one, making sure that they are receiving the appropriate training. Their trainings that really focus on the populations that we're serving and how we can best serve them, and taking advantage of those. I think another thing is to give people a way to kind of advance in their roles. That might be a little difficult for some other organizations than it is for others. But one thing that we've done here is develop career ladders. Our young folks, they are getting their degrees and they are really realizing like this little bit of money is not it. I don't know how I let y'all play in my face. I'm leaving. And we knew that we needed, because we had great people, great quality workers that were leaving, going for other opportunities that you can't be mad at, but it's like you would really want to hold on to them. So we developed career ladders that gave them something to kind of shoot for, gave them an opportunity to advance in their career, make more money, and hopefully we can get them to stick around a little longer. So making sure that they have those trainings available to them. Everything that comes from Black AIDS Institute, I'm shooting my team's way. Anything that's focused on us, by us, I'm shooting my team's way to empower them, to equip them to do the work that they need to do in the communities that look like us.
Thank you, Kara. And if I may add also self-care, I think that the work can lead to burnout. So I think that we have to, as Black people, constantly practice self-care and taking time for yourself.
Absolutely.
And I just would say one other quick thing to that too. We also have to really this is the political piece. We have to also fight back against what's happening with the kind of, right wing, increasingly intentionally, what's the word I want? Undermining public trust in public health infrastructure, right? Because given everything that we've seen in the last 3 years in particular, although these things have been happening for much longer, COVID gave them the opportunity to try to basically undermine the role of public health across the country by, in some places, changing the law so that the public health authority can no longer make, public health policy changes in an epidemic or pandemic emergency. Things like that actually have, just made it for the people who wanted to stay in public health really difficult when people are screaming at you and, or you see online people are talking smack about various kind of public health agencies because of this, that, and whatever. And so I think some of what is also happening is, our role as public health, folks is under attack, and people are, making decisions to find other things to do because, who wants to be in a situation where you constantly have, people and people just actually being physically threatened, right? I think we have to also think about what's happening in that context.
Thank you, Kenyon. And just a couple more questions, maybe one or two before I wrap up and hand it over to Michael. So now that we have the roadmap and you presented the document, we have this foundation of strategies to increase uptake for PrEP in Black America. Where do we go next? Right, I think that's the question for everyone. Like, where do we take this information next?
So I really feel like we need to have some internal structure. And I think that, again, like I said, we don't have as much power as we could because, we got to get away from the belief that if I'm supporting this group, I'm against this group. No. I can very much support my cause, but very much be in agreement with your cause. It doesn't weaken us, it actually strengthens us. And we have to leverage that. Just like we have Black radio, we have so many Black businesses, we have Black media, we have so many Black companies, Black millionaires. At which point do we say this is a problem for our people? So if you want to do business with us, this needs to be an issue for you. We need funds for this. We need advertising for this. We need information for this because the drug companies, they are capitalists and it's okay. It's a business. But the reality of the situation is if we're waiting for somebody, because we've been waiting how many years now? A few hundred. If we're waiting for somebody to rescue us for our cause, it's not going to happen. We have to start, we have enough money in our community that we have to start monetizing each other and mobilizing each other so that we get this out and we become a force to say, hey, if you're working with these people, this is what you're going to do. This is what you have to do. This is what you're going to give. We give away so much for free and we demand nothing. And so I think in order to gain that strength and that momentum, it needs to be some internal structure before we go out and say, this is what we need, because the message falls apart because there's no structure to it, if that makes any sense.
It does, it does. Did anyone else have anything to add?
I'll say we have to just make sure we're keeping the conversation going as well. As Kenyon said, you know, a lot of these conversations that started with just the 9 of us, you know, it grew out of that and turned into a summit, which led to this webinar now that we've had a great turnout for. And we were able to produce a roadmap document. And I think it's important that we keep the conversation going with, as we're going to announce soon, and you know, future summit. But there are other issues that we definitely have to address. Even in the last summit, you know, we talked about people who should have been in the room, but for whatever reason, they weren't in the room, who their voices needed to be heard as we continue to produce more documents like that and engage our health departments and legislators and saying, this is what our community needs and wants. Definitely, I know one of the conversations that's come up is, you know, as people are exiting the criminal justice system, how do we engage them around preventative services? How do we link them to making sure we're engaging them to get back into HIV care? Making sure that people who are unhoused, those populations are we addressing their needs? You know, because one thing as somebody who's done case management, linkage to care, navigation, when people's basic needs aren't being met, when their mental health isn't right, you can't put them in a place to say, hey, we need you to come in and get your labs done every 3 months, and also, you know, take this pill every day, because you create, you know, so we definitely need to hear from all of the sub communities within our larger Black community. And, you know, I definitely think we did a good job of bringing a lot of diverse voices to the table, but there's always going to be somebody who's not represented in the room or underrepresented in the room. So I think as we continue to have these conversations, making sure that we are even learning ourselves. I know sometimes when I work with different subpopulations or different people within our community, it's like, oh, wait, I didn't think of that. I didn't realize this was a issue that prevents somebody from being adherent or coming to an appointment, you know? So I think as we continue to grow these conversations and making sure we're intentional about bringing more diverse voices in, and making sure that we're bringing that information to the right stakeholders, making sure we're, again, engaging our health departments, making sure we're engaging our different bodies like the like the National Public Health Groups or National Social Workers, Association of Social Workers, like those larger groups that say, hey, you know, this is how case management should look for these populations. This is how services should be brought to these populations. These are some of the barriers that we need to address, whether through legislation or through our health departments or through other community organizations and resources, and just keeping those conversations going.
Thank you, Michael. And this is one more question because they're coming into the chat. So this is you, Dr. Rogers. It says, I'm a doctoral student researching the disparate HIV rates among Black cisgender heterosexual women, which is another topic that is the whole webinar that we need to talk about prepping for Black women. But it says, do you believe it would be more helpful to have a provider level PrEP education course or a patient level PrEP education course, or both?
I think that both are necessary. I think that absolutely both are necessary because, to be perfectly honest, Black cisgender heterosexual women have a very unique struggle that is very different. It's not bigger, it's not better, it's not more important, it's just different than the other demographics that actually put this demographic at a little bit of a higher risk in some cases. And I think that a lot of these women don't understand that. They don't understand their position. They don't understand sexual equity. They don't understand these things. And so they need to learn that perspective of it. But again, physicians need to also understand, because you'd be surprised at how many physicians are like, she's married, we didn't test her. Or, you know, she doesn't do this, she doesn't do this, right? But she has a whole partner, and all you can do is go on what she says about her behavior. And outside of that, it's just a whole unique situation that I think, again, when we hone in on Black cisgender heterosexual women, people get, for some reason, angry. Like, nobody's taking away anybody else's struggle, nobody's taking away anybody else's journey, but we have to start somewhere. And so I think that both of those educational programs are very important. That was a great question.
Thank you. And we are approaching time, and I just want to extend a thank you to everyone on the panel, Danielle, Carrie, Kenyon, especially you, Dr. Rogers. And I think this was a great way to celebrate National Black HIV Awareness Day, because oftentimes when you think about National HIV Awareness, especially for Black people, they put up the stats and the data and all the information that most of us already know. But I just want to applaud us for being here, and also all the work that has been done to really shift the narrative for Black people as it relates to HIV. And we will continue to work, and the fight is not over. So I'm going to pass it over to you, Michael, to close us out.
I'm gonna get that microphone right one day, I told you. So I am not good at keeping secrets. I've been holding this in for a while now. We had like such a great, amazing summit in Atlanta at Thrive SS. And afterwards, as I said, we had to keep the conversation going. So we started talking about other cities that we can hold a summit in. And I'm always one of those people who likes to do things collectively and democratically. So I had one city in mind, but we started throwing out cities. And when it came time to vote for it, I was crossing my fingers that this one city that is really, really special to me, that we can have it, the next summit in. And when it came down to a vote, we voted unanimously that this would be the city that we would hold the next summit in. And rather than say it, I am going to share the flyer. So make sure you repost it on social media. It'll be on social media channels within the next few minutes. Let me go ahead and share my screen.
We need a drum roll.
Right, I was thinking
some music, something.
The next PrEP in Black America Summit will be in New Orleans, Louisiana, my hometown.
Okay.
Yeah, so
May 19th, 2023. So make sure you are getting prepared. We're going to have more information coming out, but make sure you visit prepforall.org/PrEP in Black America, or you can email me, Michael, at prepforall.org. That's where we will keep people updated. That's where we will post the registration link. Also, make sure you're following us on social media, PrEP in Black America on Facebook and Instagram, and PrEP in Black US on Twitter. And also within the next several minutes, as soon as we get off the call, I will upload the roadmap document. A lot of people dropped the question in the chat. How can they get a copy of the roadmap document that Danielle presented? So I will have this flyer, and I will also have the roadmap document on the website this afternoon, and it'll be on social media. So definitely make sure to follow us, definitely make sure to share, and definitely make sure to share that roadmap document. We want as many people in our community to engage with it as possible, because, you know, definitely a lot of ideas came out of the last summit, and we want to spread those ideas, definitely.
thank you, Michael. And will the recording from today's webinar also be sent out, correct?
Yes, I will have that on YouTube as well. Might take a little longer to get it on YouTube, but it will definitely be on there this week.
Okay. And once again, thank you all.
And that will be posted to our page as well.
Okay. Thank you, Michael. And enjoy the rest of you all's day. And thank you for tuning in.
Thank you. Thanks for having us.